Okay, again, welcome. My name is Dr. Hunter Peterson, and I'm a naturopathic physician and the clinic director here at Coeur d'Alene Healing Arts. Today's open forum, which is a monthly opportunity to talk with one of our doctors and hear about what we have to say on a health topic, is going to be about naturopathic approach to prevention and treatment of acute illnesses, primarily focused on colds and flus. And so I think how I'm going to start this conversation is to zoom out into a place of discussing infectious disease in general. All right, so one of the main things that can become a threat to our health is harboring infectious processes that are originated from a colonization of viruses or bacteria or fungus that reside and build up in our body. And if our body is unable to fight it and overcome it, then it's even possible that we succumb or die from a kind of overwhelm of that infectious process. This actually was an incredibly common cause, in fact, the most common cause of death up until very recently in our human history. Infection, whether acute or sometimes chronic, but mostly acute, was responsible for the vast majorities of deaths until about the early 1900s, and specifically infections of bacterial nature. And what came about at that time that really changed things was, well, many things actually. But I will attribute a little bit of credit where credit is due to the advent of some of the modern drug medicines, including antibiotics, which have the ability to attack and kill off really advanced bacterial infections. So nowadays, the most common things that kills people is chronic diseases, heart disease, cancer, various conditions of the lungs, conditions of the intestinal system that are very chronic in nature. And so we actually don't have as much acute disease that kills people, although it still does, especially so in third world countries where there is not good access to easy and good access to modern healthcare. And so what, however, is true is that we all are affected by acute illnesses, that we all are very intimately familiar as adults with, and certainly if we've had children, what it is like to go through a cold, go through a flu, go through an earache, go through a sore throat or laryngitis, maybe even go through bronchitis and pneumonia for many of us. So those are going to be kind of the host of conditions I'll be focusing on discussing today. And as is my tendency, I am actually going to start in a place that really describes in a more granular detail my philosophy and viewpoint on what infections really are as a definition, as well as what creates the circumstances for infection or what causes them. Because I don't think that that's necessarily an obvious, agreeable answer to everybody. And in fact, I think my position on this would be quite divergent from what the mainstream conventional medical paradigm would say about this. So, in getting into that topic, then I really want to get to talking about some theories of infectious disease. So when we're talking about infection, we're talking about viruses, bacteria, funguses that invade the body and set up shop and multiply and grow and end up causing health consequences of many types, up to and including death, as I mentioned. Now, there are, I think, two key variables that we have to consider with what makes the circumstances for an infection to occur. And I want to get into these, kind of architects of infectious disease theory to discuss this, because they go back a few hundred years. As we got microscopes and we started to be able to look at these little bugs in really close zooming in, we were able to learn that indeed pustules and different, excretions with acute illnesses had these little microbes in them, and we called them bacterium. And Louis Pasteur was the big guy who's famous for identifying these microorganisms in secretions in diseased tissues from infections. And he created the popularized or mainstream medical paradigm of infectious disease. And the equation is quite simple. It is that having a pathogen, exposure to a pathogen, equals acquisition of disease. So it's kind of a 1-to-1 ratio. If you're exposed to a pathogen, then you're going to manifest the disease. And that essentially is the modern medical paradigm. And so the rationality is the main thing we have to focus on is the pathogen, exposure to the pathogen, as well as if the pathogen has inhabited our body, killing and getting rid of the pathogen. We see a very obvious in these last couple of years, culture and worldwide engagement of this concept with the quote unquote shutdowns and the mask mandates and the hand washing and the social isolation or social distancing, as they have called this, which the design of that is to use this microbial theory of infectious disease, where if you avoid exposure to the pathogen, you cannot create an infection. And so that's a major point that's been put in all of our minds and eyes in these last 2 years. And on the conventional end, if that exposure does happen, then we go into ways to kill the bugs. And so conventional medicine's developed some tools to do so. We have developed antibiotics for bacteria. It's a major tool there. We've also developed some antiviral drugs as well as some antifungals. And these tools get into the body and go in and actually work to destroy microbes through very specific mechanisms, which modern science has been able to kind of invent and then manufacture. And so that is the microbial theory of disease, the predominant one in our culture and mainstream medicine. However, there was a contemporary of Louis Pasteur. His name was Claude Bernard, and they actually did a lot of corresponding, and they kind of, argued about whose theory was correct in regards to what creates the conditions for infectious disease. And Claude Bernard agreed that you do need to have the microbe present. If the microbe's not present, there's not going to be disease or acute, infection. But he also stated there's another key variable here. We need another set of circumstances in order for infection to happen. And that second circumstance is a susceptible terrain or a susceptible host or a susceptible organism, or another metaphor would be a susceptible soil for which that pathogen is able to utilize as a growth medium to seed and develop infection. And this theory, which is the theory I ascribe to, is hugely significant in terms of how I approach infectious disease and how I understand not just the treatment of it, but also the prevention of it. So because there is this second variable of terrain or the susceptibility of the host organism, there's a lot more to really understand as to who gets infections and who doesn't, and who's more susceptible and who's not. And indeed, we see this all the time in our society. It's actually a well kind of understood phenomenon that if you're at a small dinner party or a Thanksgiving gathering and someone unknowingly comes with an illness and is spitting out a lot of virus or a lot of bacteria and everyone's getting exposed to it, we never see everybody get ill, even though clearly everybody was exposed. And the reasoning for that is pretty clear to me. It's this susceptibility or terrain element that those who did not acquire infection did not have a susceptible terrain to the pathogen. And so that's really a key element, both in the prevention and treatment of infectious disease, And to me, during this pandemic, what is the most important thing for us to kind of grasp onto and be really engaged with as a concept for how to keep our society safe and healthy? Now, I am not dismissing the exposure element, right? The pathogen still has to be there to cause illness, but we're also social beings. We actually need social physical contact with each other to thrive. In fact, we know that if we don't have babies who are touched, they die. It's a very powerful need as human beings. And so we can't have this mentality, in my opinion, that we need to be fearful of pathogens, and in doing so, to respond to that, use this microbial theory of isolation and removal from exposure, because pathogens are part of our life and they're all around us all the time. What we really need to talk more deeply about is the terrain, the individual susceptibility. A nice little metaphor to kind of draw that together that I use with pediatric patients is when I'm talking about what susceptibility is about, I say, if you have a bunch of flies and bees buzzing around a smelly can of trash, and those flies and bees are stinging you and they're biting you and they're swarming and causing you a lot of grief, well, let's call those flies and bees, those are the infection that our body might be harboring. And so there's two ways, in my opinion, we can address that and deal with that. The first is the conventional mainstream medical model. Let's go get some nasty insecticide that kills and paralyzes and literally kills those bugs and spray it all over till those bugs all die. And then that infection's gone. Of course, temporarily it's gone because we've left the trash there. And that smelly trash, as long as it's around and attracting bugs, then more bugs are going to hatch and more will come in and take advantage of that smelly medium. And pretty soon they'll be swarming again. The train theory would state, let's not focus on the bugs too much. Let's ask the question, what is allowing the bugs to be there, and look at that smelly trash. And as a naturopathic doctor, the metaphorical approach is going to be, let's take out the trash. Let's get rid of that trash. And once that trash is gone, there's not going to be any flies. There's not going to be any bees there. And they'll permanently be gone because there's no longer any trash. So that's the model I really want to talk to you all about. And I feel like it's important, even before we get into treating illnesses, acute illnesses and infections, to talk about how do we not get them in the first place? Because I think we all know it's not fun to be sick. It's a unpleasant. The symptoms are not fun, and of course, in the worst case scenario, they can be life-threatening. Nevertheless, I think the goal of our work should be building health rather than reacting to illness. And that's just a naturopathic principle in general that I hold dearly. And unfortunately, our entire medical system is modeled on a reactionary approach to health, and not entirely the medical system's fault. It's also because human beings are very reactionary. That's our brains are wired, is we're not going to change something we're doing unless that thing we're doing is very noticeably causing us harm or discomfort or pain. And so I want to just state that and not place blame in very specific areas of health approaches. Nevertheless, I really am dedicated and believe very strongly in facing our health in a very in-depth, detailed way, and really trying to understand ourselves deeply, even when we're not our backs are up against the wall and we're fighting really serious limitation. And so that's the way I'm going to talk about infectious disease to begin with. I think before I talk about terrain and what influences our terrain, I do want to spend a couple minutes just explaining our immune system. Because when we talk about infection, we can't talk about it without talking about the immune system. And in fact, this is often a confusion amongst people. When you experience the symptoms of being acutely ill, what you are experiencing is the effects of your immune system responding to the presence of the pathogens in your body, to the viruses, bacteria, fungus, whatever infection is being harbored. And so it's really important, therefore, to understand how the immune system works in order to really understand the body's relationship with infectious agents and how it deals with them. And so, to look more deeply at that, then let's talk about the immune system. So, we have two basically core arms of our immune system. We have what's called the innate immune system, and we have the adaptive immune system. And these are constituents in our body that our body makes to protect us against pathogens. We didn't have these constituents, we would succumb to infectious disease very quickly. And on that innate immune level, what we mean is broad spectrum actions that our body takes to protect us against pathogens. And there's some very obvious big ones. So one of them is just our skin barrier, right? Our skin is a not very permeable membrane. It doesn't, it's not it's not leaky enough to let pathogens through unless there's cut or open wounds. And so that's a great barrier in defense. Our stomach has this really, really acidic environment. So the things that we swallow and ingest get totally killed for the most part in our stomach at its very, very acidic pH. Of course, some people have really weakened pH in their stomach, which can cause problems in this regard. But that's one of our chief protective mechanisms. Another place that's really common for pathogens to get in our body is through our airways and through our mucous membranes, our sinuses, our ear canals, our mouth, and lung passages. And so in those areas, the body has quite a few defense systems. We have mucins, or the mucus, that kind of makes those surfaces slippery, so it's hard for pathogens to land. And that's really supported by good hydration, means those mucus linings are even better and healthier. We also have defensins, lysozymes, what are called macrophages, these non-specific immune cells that are either microbially static or microbially cidal, meaning killing of microbes. And these are generalized killers. They're not specific to any certain type of virus or bacteria. So many times those defense mechanisms are sufficient to prevent, when we get exposed to a particularly bad pathogen, us from acquiring infection. However, there are times when pathogens evade those defense barriers and they kind of establish themselves in our tissues or often in our mucous membranes, right? So our throat, our lungs, our sinuses, our ear canals, vaginal tissue. And in those cases where things start to get established, this is usually where we have the progression of what we call an acute illness. And that's where the body starts mounting a more aggressive immune response. And usually the illness is a bit drawn out. And partly why that is that we're turning on our adaptive immune system. And what that means is it's the part of our immune system that is very unique and specific to the pathogen. And so this is where we start to get this terminology and nomenclature of antibodies and killer T cells and dendritic presenting cells and helper T cells. And all of these terms, maybe some of you are familiar with, are these basically elements in our immune system that go out and sample the virus or bacteria as it's establishing itself and says, uh-oh, there's an invader. Let's go out and make a bunch of killing cells immunologically specific to that pathogen. So these are various types of white blood cells that are specific to the pathogen, whereas the more generalized ones we talked about, like macrophages and eosinophils and monocytes and neutrophils, these are those more broad, sweeping, attacking infection compounds that go against any pathogen. So mounting those antibody and killer T and helper T responses takes a few days, because what has to happen is you sample the antigen on the virus or bacteria, you take it back to the lymph nodes, and let me explain that, because that's another big part of the immune system, is the lymphatic system. In the lymphatic system, you can think of as the highway that shuttles immune materials between different tissues, and also is the communication pathway for immune tissue and immune cells to communicate. And these nodes where they hang out, their hubs, their little cities, are all over our body, primarily in our intestinal tract from our mouth to our anus, because that's the big exposure to the outside world. But we also have them throughout our body. And so that's often why with infections, lymph nodes will become enlarged because there's a lot going on at those immune hubs. So when that happens, when those immune activities get ramped up as the adaptive response, then we actually make these specific responses to those infections. And that's really cool because then we almost always completely clear the infection with that adaptive response. And so usually because it takes 2 to 4 days to start to mount that response, typical acute illnesses last anywhere from 3 to 7 days on a normal course. Now, sometimes if our innate immune system is able to bat it back, it could be only the 24 hours or really short duration. But those other ones can take longer when we need to get to that adaptive response to help out in clearing things. And so a big buzzword came up, antibodies, right, which we're all very familiar with in terms of some specific terminology that's been very big in our culture and society right now, which is immunizations or vaccines. So the idea and the mechanism of an immunization or a vaccine is you take a virus or bacteria, you tweak it so it's not harmful. You only use a certain part of it. And then you inject it into the body with some other constituents that's going to really make the immune system go seek it out. And you build an adaptive response to that virus or bacteria, even though you haven't been exposed to it out in nature, out in the community. And so the theory goes that when you get exposed to that pathogen out in the community, you already have the part of the adaptive immune response queued up, so that you have a less intensive illness duration, or you don't acquire the illness at all. And so that is a big concept that's very controversial right now and is kind of being deployed en masse across the world for the coronavirus that's being treated around the world right now. And so that is one methodology to do some, in conventional medical terms, immune protective efforts. There's a other side to the coin of that, which is that stimulating a really aggressive immune response can be through a vaccine intramuscularly, can be really activating to the immune system. And in some individuals, that can cause the immune system to activate in other ways that the vaccine is not intending. And so there's a host of possibilities that can come from that, anywhere from blood clotting to major local site reactions to autoimmune activation to dysregulation of various patterns in the body, like menstrual cycles. And the list is kind of endless in terms of what can happen from those inappropriate immune responses. This can also happen when you're exposed to a virus out in the community, just in the normal fashion through your mucous membranes. But there's quite a bit of debate as to the likelihood of an overactivation from that exposure versus the intramuscular injecting of attenuated viruses with compounds that are synthetic into the bloodstream. And so that's just something I'm not going to talk about more today, but I wanted to put that in play as a tool that predominantly in conventional circles is used highly as what is considered in their circles a preventive tool in a treatment for infections. Okay, so now we've talked about the immune system, and I've talked a little bit about how the immune system kind of hangs out and flows. We've talked about circulation and the lymphatic system. And so now I want to get into this part about the susceptibility, the terrain issue, the whole idea of how we prevent infections. And I don't think I need to talk a lot about the exposure side. I think that y'all have been given ample information from public health authorities and conventional medicine about exposure and how that relates to infectious disease. You've heard about hand washing, you've heard about, staying home when you're sick, you've heard about quarantining if you're sick, you've heard about keeping distance from people as a less likely way for people to spray virus or bacteria onto you out in the public. And so these are all methods that are very valid, and masks are another way to screen some of those secretions from spraying onto other people. They have been around for the understanding of this since Louis Pasteur, and I will credit a huge amount of reducing disease and death from infection to this, what I'll just call a hygiene model, right? This understanding that cleanliness is important to reduce the spread of infectious disease, and not exposing yourself to pathogens reduces your likelihood you will acquire and then develop an infectious disease. But as I said, we're at a conundrum there because we're very social beings, and this is a need of ours. And so the things we love to do involve being together with each other. So let's talk about this very powerful and empowering part of how we can modulate and optimize our terrain. And by that, I mean two primary things. Well, more than that. What I mean is how we optimize the vigor of our immune system. That's number one. How we reduce the toxic burden or the susceptible soil, in this kind of metaphor of what makes our bodies good breeding grounds for pathogens and infectious materials. And how we ensure that our body moves the immune cells where they need to go and clears toxins and pathogens more efficiently. So I might start with that because I think that that is an easy one to kind of draw in, and I'm going to talk about circulation. So if infections have to do with a weakened immune system and the accumulation of toxins that build up and make pathogens easier to grow in our body, then moving our immune cells to the right places vigorously, getting rid of toxic debris, and clearing those pathogens is a really key functionality in this equation of illnesses, acute illnesses. And so circulation, both of the blood and lymphatic system, is a huge element to this. Fundamentally, the number one key thing to ensure robust circulation is exercise. Unfortunately, something that most of our culture is very out of the habit of, if at all, is regularly daily exercise. I'm not talking about walking around at work or even if you have a physical job. I'm talking about more vigorous, more intentional exercise. And what that does is by moving and pumping our muscles, we're literally pumping our blood and lymph, and we're circulating this main energy, nutrient, toxin exchange pathway that's so crucial for our body. And that's ultimately how we get toxins to the eliminatory organs and get the immune cells where they need to go to fight infection and protect against infection. So exercise is key, and I just will leave it at that. We could talk for an hour about exercise, but I really feel that that is one of the most succinct key things you can do to prevent infections. And I see this bear out all the time in my patients who have shifted a lifestyle into a more active physical activity. They just get sick way less. Now, there are passive secondary ways to enhance circulation. One of the best ways is the contrast of hot and cold water on the skin surface. And what that does is it vasodilates and vasoconstricts, meaning expands and contracts our lymph and blood vessels, which pumps our blood. That can be as simple as doing contrast cold endings to our showers, or you can make it more advanced, like doing it in complete immersions, like cold plunges or rivers, and hot tubs and saunas and these things. But that pumping, mechanical pumping of the blood is great. Other things that gently help this, dry skin brushing, getting massage therapy done, having like red light therapies or laser therapies. That's an emerging technology. Saunas can really help in this regard. So anything that moves the blood vigorously and consistently is very helpful from a prevention terrain standpoint. I also want to mention the importance of, to me, two really key elements of our day-to-day health on many levels, including acute illness, which is sleep and stress. Start with sleep, just because, fundamentally we understand we need to sleep. We understand we don't feel well when we don't sleep enough. However, in an immunological setting, we have to also appreciate that adequate and good quality sleep is a major element of what allows our immune cells to regenerate, to be vigorous, and to be to be really robust. So when that's inadequate and compromised, then we weaken our immune system, we increase our susceptibility to infection. And the key there is to recognize if it's a chronic pattern, it's a good thing to ask for help with and work on improving the pattern of sleep. If it's more of a choice and belief thing that sleep is not important, then I'm just going to really challenge that belief system in my experience as a clinician to say that I feel like sleep is one of the most vital and important things to our health and well-being that there is. And so those efforts of dedicating adequate time to sleep is important. In the realm of stress, this is a topic I could really key off on, but I want to mention a little example that I think many of you can resonate with if y'all have gone through school, taken tests growing up, had deadlines, this experience where you work really, really hard or really, really stressed leading up to a deadline, you get through it, and then almost immediately you start to feel sick. And that almost universal experience people have had, what it is illustrating is this propensity for stress to suppress our immune response. Remember how I said that the symptoms of infection are our immune response to the presence of infection? Well, when you're stressed out leading up to a deadline or test, you're basically suppressing your immunity. And during that time, pathogens, microbes are seeding, they're building, they're starting to develop infection in your body. And when you finally release that stress after you've made it through the event or experience, the immune system wakes up and you have a massive symptom response shortly thereafter to try to clear or remove the pathogen. And so that example is just kind of illustrative of something that is always true, which is that an amplified stress response suppresses immunity and makes us more susceptible to infection. And so in our Western modernized society, my opinion and observation and experience as a clinician is that stress is probably, of anything else, the single biggest driver of chronic and acute illness that there is. And we are in a very chronically stressed state as a culture, partly because of the values that our culture's instilled, partly because of the technology changes that has our brain constantly overstimulated. And partly just because we don't really live in environments anymore that are conducive to our natural state, which is a different pace to life and to be more immersed in nature. And so our stress systems, nervous system integration, and mind are much more keyed up. And one of the main system that gets knocked out and suppressed is our immune system in that setting. And of course, these are like life situations too, right? Not just a test. We're talking about a stress force in a job or a relationship trouble or a kind of experience where someone said something hurtful, or disappointment or grief or anger, all those situations where we're responding to circumstances. And those all actually, the brain triggers a bunch of these stress mediated pathways, which one of the outcomes is suppression of the immune system. So I guess I have to say, incredibly tragically, really, that this whole pandemic has felt like a time where the most contagious thing happening through all of this is the pervasiveness of fear. And this concept that we have been as a society so indoctrinated to become fearful of a microbe and its ability to kill us, because we're unique as a species in ability to be conscious and perceive the concept of death. And so we have immense fear around exposure and acquiring of this virus, which I feel has led to a profound amplification of an underlying base stress response in the body. And this increase in base stress response combined with going along with the fear, the social isolation, and the generalized isolation and deprivation of the things that make us happy and make us grounded and balanced is creating an incredibly more susceptible society to illness and disease, and actually tragically the pathogen itself that we're fearing so much that therefore we're now more susceptible to because of. And so I want to just share that I don't feel like it has to be that way, especially if we understand acute illnesses, acute infection through this context of susceptibility and all the things we have power and choice over as agency to engage with to buttress our immune health and reduce our toxicity. Okay. So a couple of other areas of emphasis. Probably the next biggest one, or equally big one, is going to be the accumulation of toxins in our body. And this happens in a lot of different ways. But in my experience, and I'm just going to kind of, because it's a short lecture, we're going to end in 20 minutes. I'm just going to really focus on one big area, right? I mean, I could talk about cigarettes and, environmental toxicants in our, cities and homes and all of that are toxins accumulate in our body. But really, the biggest toxin that accumulates is the thing we put in our body the most, which is food. So it is my opinion that the things that we put in our body food-wise as a society has a lot of capacity to knock out the function of the immune system and create a medium, a growth medium in the body that really, really makes us more susceptible to acquiring and hosting viruses and bacteria. The obvious example of that is the massive consumption of refined starch and sugar in our society. I mean, massive amounts, like some insane amount, like 120 pounds of white sugar a year, the average American. Of course, this is highly toxic to our body, and it is a huge, essentially feeding force to infection. I mean, all of these viruses and bacteria, they exclusively thrive and secure livelihood off of sugar. Furthermore, that sugar damages our immune system's ability to function. So it's a double harm. And the consumption of not just sugar, but also all the refined foods, the chips and crackers and breads and boxed goods and pastas and, on and on and on, are these really toxic foods that we're constantly putting in our bodies. And it doesn't just stop there. I mean, I would argue that a huge element causing dysregulation and amplified susceptibility is cow dairy, consumed in pretty large quantities in our society too, and really many other foods. I mean, especially genetically modified organisms, but potato is a big one for a lot of people. Wheat is a huge one for a lot of people. Essentially acknowledging that we do have food sensitivities, and as we alter our foods more and more, we're developing more sensitivities, and our bodies don't use those foods efficiently. They are seen as hostile and toxic to the body, and the body has to get rid of them somehow. It's got to discharge that toxicity. And oftentimes what it'll do is it'll plop all of those compounds onto our mucous membranes, which, guess what, is right where our pathogens like to land and start to set up shop. And so, really simply put, our lack of consciousness and caring for what we put in our body as a form of foods is a major driver of decreased immune vigor and increased toxic burden, or kind of susceptible soil for the pathogens that cause acute illness. So I could get into so much more, because all of the food stuff also, and the stress stuff for that matter, really interfaces with the main way our immune system gains its vigor and intelligence, which is actually through its interface with the gut microbiome, the trillions and trillions of organisms that live in your gut that have this very intimate, intricate, and interconnected relationship with your immune system. There's a reason that 50 to 70% of our lymph nodes are in our gut. It's because our immune system is constantly sampling the microbes in our gut to learn how to be most attuned and intelligent and appropriate in its response. So when we're eating poorly, when we're stressed out, we're also skewing those bugs that live in our gut and causing inflammation directly in the gut lining, which is affecting our immune function and immune vigor. So I want to just make a quick note of that. Many of these topics I'm kind of glancing over: stress, circulation, gut health. I have many other videos I've shared in depth about them. So if this is kind of a rabbit hole thing that you want to really dive into, then I encourage you to learn more in some of those spheres where I go into more depth. There's another part of the susceptibility conversation that has to do with the toxicity that I think is important to mention, which is the removal of toxins, right? So we're talking a lot about how they get into our body, not as much about how we remove them, but it turns out that combined with good circulation, which circulation gets those toxins to the elimination organs, we want to attend to the quality of elimination from our elimination pathways. And those primary pathways are the kidneys, the bowels, and associated with the bowels is the liver, which is our main detox organ, and the lungs, and the skin and lymphatic system. So if those systems are sluggish or not eliminating appropriately, then we are going to have major issues of bottlenecking toxins in our body. So people with constipation, people who don't drink enough water, people who never sweat or don't move their lymph. These are big issues in terms of what harms and shuts down elimination pathways and causes a backlog of toxic buildup. And that's a big way that this, again, susceptibility level enhances. So really attending to those functions within each of us. And again, really with all of these preventive measures, there are some really practical things you can do and be attentive to. One of the big articles I love that I wrote a long time ago is called The Determinants of Health, which is what we've kind of been touching on many of those here. I have some very simple guidance and kind of just, wisdom, but ultimately this is an individual conversation with each person. But kind of evaluating these deterministic factors is a huge amount to do with the prevention of infections and illness. And so I know that that's a very long-winded way of me arriving at the treatment of infections once we have them, but I feel like that's what matters actually most to us, and that's where more of our energy should go. However, when we do end up coming down with symptoms of illness, then I think a valid question and tool of awareness for all of us is, what do we do to help the body clear that pathogen, clear that virus, clear that bacteria? And again, my toolbox as a naturopathic physician is going to be very different than the mainstream medicine. I do, on very rare occasion, prescribe antibiotics, which is essentially the main tool for conventional medicine. But I don't do it a lot, very rarely, because antibiotics have this very, kind of vicious cycle they can precipitate, which is when you treat an infection with an antibiotic, you may kill the infection, but you're also going to totally mess with your immune system's baseline health, in large part via the gut, right? Because you're going to wipe out a bunch of the good bugs in your gut, and you're going to weaken your core immune function from to be lower than it was before the infection. And that's only if you have a bacteria. If you have a virus, then conventional medicine's wisdom is, go home and wait it out. And if you utterly cannot function and you think you're going to die, then go to the hospital. And I hate saying it so callously, but that's really what we've seen during this pandemic, is a lot of that behavior coming from that community. And so fortunately, with natural medicine and naturopathic care, we have a lot more tools at our disposal to deploy. And I'm going to start to talk about some of those. So I actually do want to speak really directly, rather than jumping into actual medicines, to talk about some of the core modalities that are so crucial. So, number one, we got to talk about fasting. So, the concept of infectious disease is that once you have an infection established, you want to not feed that infection at all, and you want to bring more resources to your immune system to fight that infection. And by stopping the intake of solid foods, you achieve both those purposes, because when you start to fast on, say, a vegetable broth or a bone broth, just like really cook down veggies, or cook down bones and the clear broth of that, and that's it, really, that's it. You essentially put yourself on digestive rest. And so all the energy, the 40% of energy daily you use digesting, gets reallocated to fighting that infection. And secondarily, when you fast, you're also going to deprive that infection of its food source, right? I told you these bugs feed on sugar. And so if you remove the intakes of sugars and foods from your diet, then they're not going to have anything to feed on, and they're just going to kind of, peter out. So I'll often encourage a 48 to 72 hour fast when I treat people for acute illness symptom onset. And I think any acute infection, it's a great idea. Now, if you can't bring yourself to that, if you don't have the bandwidth to just really push that on your, lifestyle, then at the very least, removing all sugar and all refined starches, right? So all your breads, pastas, crackers, chips, cereals, all of your sugary things, dried fruit, candy, any of those kind of things very much are going to help not feed that infection. And secondarily, dairy. Dairy is very, very mucus forming. And so removing all dairy through the duration of an acute illness is super critical. And these are simple tools, but they are powerful. They work incredibly well, even in isolation. If you don't have any medicines in your toolkit, just doing that alone will enhance the speed at which your body clears the infection. And it's extraordinarily rare you'd even need to call the doctor to get additional help if you even just use that tool. I would kind of bump onto that tool this concept of making sure your tissues are really hydrated and your mucous membranes are hydrated. This is very key to immune function and to preventing your pathogens from adhering to your body. And so minimum of 100 ounces of water a day during acute symptoms. Using lemon can be further mucolytic. So squeezing a lemon or lemon juice into each glass of water is a really good mucolytic compound. And then you can do other topical treatments. Like if you have a sore throat or you have congestion in your sinuses, you can gargle salt water and spit it out, or you can kind of bring salt water into your sinus passages, what they call like nasal rinses or neti pots, to kind of clear some of those pathogens out and clear that mucus and slipperiness. So those are very practical things that also can be done. Steam inhalation is another lovely one when the sinuses and the ears are congested. And you can even put a few drops of eucalyptus or thyme, which are very antimicrobial essential oils, into there to kind of, or there's one called, I think, grapefruit seed extract drops. You can get that over the counter. We have them here too. 10 of those drops in there to just kind of help in the neti pot as well, help clear those pathogens off the membranes. The next really, really big thing that is so helpful is hydrotherapy. Remember how we talked about moving the blood, gets the immune system where it needs to go, clears out the toxins. So practically speaking, when people have illnesses, I do a little more precise prescribing of hydrotherapy. So for example, if a kiddo has a stuffy nose or earache, I will have the parents make sure their feet are warm. put some thin socks under cold water, wring those socks out and put those socks on their feet, and then cover them with a thicker wool or like a hiking sock and put them to bed. And that localized hydrotherapy draws all that congestion out of their head and dramatically reduces the likelihood of sustained illness. It really shortens the duration. That also works for an adult with congestive sinus, headache, earache, anything up in the head, really pull it down. Now, if the infection's settling into the lungs, a really good thing is to do that same concept, but use a wet t-shirt that's wrung out and then cover it with a sweater and go to bed. I usually tell people to take a hot shower before they put the t-shirt on. Incredible tool. I've treated lots of bronchitis and pneumonia with good success using that action. So those are some really basic hydrotherapy. Another one, you can do a warming throat compress, thin washcloth wrung out, cold water, wrap it with a scarf. Again, they kind of go on. Now, mentioning the lungs, I do want to mention another procedure I love, especially when I treat pneumonia, which I rarely have seen a need for antibiotics in treating pneumonia, just an FYI for our patients, if it gets to that stage. But mustard plasters, making a mustard paste on cheesecloth with flour, actually dries out and literally draws the moisture and congestion out of the lungs. So really good tool. Our office has handouts on all of these if you wanted to call up, and I think some of them are on our website too. So I actually want to pause for a quick sec before I jump into the topics, because I do want to mention something very important to me that I really get upset about in mainstream medicine that is so oppositional to how I understand acute illness, which is the concept of fevers, right? Fever is a major symptom of acute illness. And yes, it's an intelligent response by our bodies to an infectious process that our body's trying to clear. When our body raises its basal temperature, our immune system becomes much more active and therefore is able to clear the infection and the pathogens much more quickly. And really, to me, kind of the more robust a fever, the better. I mean, I like to see a fever between 101 and 103. I think that's showing a very vital body that is going to help full clearance of the pathogen quickest. So I don't want to suppress fevers. Now, if people are getting really uncomfortable with their fevers, if they're not able to sleep, if they're starting to have altered level of consciousness and unresponsive to stimulus, okay, well, that's times where we need to maybe modulate a fever. But even when that happens, I'm not going to do it with Tylenol and ibuprofen usually. I'm going to get the child into a neutral water bath and put a cold washcloth on their head and maybe lower their temperature by a couple of degrees. So there's ways to do fever modulation that is not fever suppression. When we suppress the fever, I feel like we reduce the discomfort, but we often draw out the illness. Furthermore, the big worry most people have about fever is febrile seizures, which is this concept of actually seizure activity, which is not about the temperature of the body. It's about the rate of the change in temperature in the body. So a good, just steady 103, 104 degree fever is much safer than a temperature that goes from 97 to 102 in 10 minutes. That's much more dangerous to trigger a nervous system spasm. And so actually, when we suppress fevers with Tylenol and ibuprofen, then when those agents wear off, the body kicks its fever response back on. And it's actually one of the most common ways that febrile seizures happen. And so that's a kind of nasty cycle to get in. It is possible for a fever to get too high. I don't want to make the statement that it can your tissues beyond what's healthy. So there are some circumstances where that is not appropriate, or we do want to modulate the fever. I just want to speak to the value of a fever, though, and say, big fan of fevers and infection and not worried when they happen, even though the symptoms of chills and heat can be a bit uncomfortable. So kind of last area, well, two areas of discussion. I know I'll probably run a little over here, but number one, I want to mention homeopathy. Homeopathy is a natural medicine modality. It's been around for hundreds of years. It's an incredibly powerful tool in the healing arts, and it's a tool that I use all the time, both in chronic illness, but also very much so in acute illness. And rather than going into a lot of detail about how homeopathy works, I will describe it as a medicine that responds to the disturbed pattern frequency in the body. And in the case of acute illness, let's just say that that pathogen that has infected the body is changing the vibrational frequency of our tissues, which is allowing the pathogen to maintain and kind of manifest in the body. And the homeopathic medicine, when it is taken, if it's the appropriate medicine, will go in and change that frequency to activate the immune system's ability to respond more efficiently in clearing that pathogen. So the key about that is you have to select the right remedy, and it's not a just simplified, oh, you have a bacterial infection, take an antibiotic. The remedy that you give has to match the unique symptom expression of the patient, right? So 10 different people with a bronchial infection might be given 10 different homeopathic remedies to treat it. And if they're given the remedy that's not matching the frequency, then that remedy is going to be ineffective. It's not going to do any benefit to activating the immune system. I've taught classes on this. There's even some videos about homeopathy and acute prescribing we have online, but I love it as a tool, and I will deploy it in almost every case that people present to me for acute illness treatment. So with that all said, many of you were probably thinking I'd spend a lot of time talking about which supplements to take, and I'm sorry to disappoint you if that was, what you were wanting. But again, I just want to really be very transparent about my philosophy about what really matters with infectious disease, and the supplements are less important, than most of these other things. However, when we get ill and we want to speed along a resolution phase, there's some great nutrients available that are non-toxic and helpful. The first one I'll mention is vitamin D, which is also preventive for the immune system. I tend to recommend for adults to do a preventive dose of about 4,000 units a day. But during infections, I'll also often ramp that dose up all the way to 20,000 units a day through the infection. And that has a great ability to ramp up immunological vigor and address, infection through the immune system. Second, vitamin C, another vitamin, has really great immunomodulatory properties, very outstanding research in oral supplementation, but also IV supplementation. We've had some good research out of China for that with coronavirus in IV or intravenous form. As a preventive dose, also preventive, 1 to 3 grams a day. And I tend to like the buffered vitamin C's, so the ascorbates versus the ascorbic acids. Those are a little more effective as C's. Also, the liposomals are more concentrated. And if you have an acute infection, you can go all the way up to 7 to 10 grams throughout the day if your bowels will tolerate it otherwise, as long as it doesn't give you diarrhea. So that's a great agent. I also want to mention a mucolytic supplement called NAC, or N-acetylcysteine, which tragically, through this pandemic, the FDA somewhat mysteriously has pulled off the market, even though it's been used for decades and decades safely. But I don't want to digress too much. We have it at the clinic, so if you're a patient, you can always obtain it from us. However, that's a very powerful tool as a mucolytic agent to strip off pathogens from the mucous membranes, both in the initial phase of infection as well as to clear out the residual mucus. And that dosing is 1,200 milligrams twice a day is what I usually recommend. Then we have this whole realm of botanical medicine, and there's some really great botanicals. Echinacea, golden seal, bloodroot. I really like andrographis. I really like osha. I really like grindelia. There's all these different herbs that work so well. And we can give those herbs in tincture form, or we can give them in capsule form, or we can even give them in teas. I have an immune tea I really like. But they have these very excellent, not only bacterial properties, but antiviral properties. We have seen really good research evidence that they have very strong activity as antiviral compounds to kill and neutralize viruses. And so we have something at the clinic called the URI, standing for upper respiratory infection tincture. We also have a formula called EHB, which stands for Echinacea hydrastis or golden seal, and bromelain. It's got a good little punch of zinc and vitamin C in there too. Love that formula. So that one I usually dose at 2 caps daily as prevention and 3 caps 4 to 5 times daily acutely. There's another compound derived from the larch tree called larch arabinogalactans. Arabinex, I like this one for kiddos because it's a powder, it's tasteless, so you can give them little small doses of it to prevent as well as treat. I usually give them a scoop a day for treatment, but a third of a scoop for prevention. And I just triple that in adults, so a scoop for prevention, 3 a day for treatment. And so those are some of the nice compounds I utilize. I also like to use medicinal mushrooms, and they have immense immune properties, and we have all sorts of evidence of these medicinal mushrooms, when they're prepared appropriately, to be preventives as well as treatments for acute infection. And so I use a professional company called JHS, but I use reishi, I use agaricus, I use turkey tail, I use a mushroom blend. So those are all great tools, and especially use them when people have kind of chronic immune dysregulation issues. Many, many more potentials, but I feel like I hit my biggies that I wanted to mention to you. So yeah, I really appreciate everybody's participation and being on the call. I know I didn't leave much room for questions, and I did not see many questions, but I hope this has been helpful to you all. I'll try to send this out to everybody and make sure we get this up on our website in the next couple of days here. So thank you all for being here, and I hope you have a great rest of your day. And as always, I look forward to the opportunity to connect with you at whatever time allows us to. Thanks so much.